While our partial hospitalization program has been proven to be beneficial for individuals seeking treatment, Crestview Recovery realizes that this may not be a realistic option for some. If you need a more intensive level of service than usual outpatient treatment, IOP could be right for you. Keep watching to find out more. Partial hospitalization versus IOP. With a partial hospitalization program, or PHP, treatment at Crestview Recovery, patients stay in a sober home for up to 90 days. They attend individual and group therapy, learn effective coping strategies, and focus on holistic recovery. However, because patients aren't able to go to their homes in the evening, it requires a greater time commitment. You'll be away from your job and family during the treatment process. However, some patients don't have the option to leave their workplace for an extended period. If they do, they may well no longer have a job. Similarly, the needs of your family don't pause even if you need treatment. As any student knows, leaving your classes for up to 90 days mean you'll end up too far behind to make up your work. Losing the time would set many students back on their educational schedule, causing significant future conflict and confusion. Often, childcare or elder care will be too much of a burden on patients if they have to step away from their household responsibilities for the typical 3 months rehab takes. No one should be penalized for wanting to get treatment for the disease of addiction. Therefore, we designed our intensive outpatient program in Portland to provide an alternative means of receiving help without sacrificing quality. Our IOP is comprehensive in the service it offers, our commitment and goals. Like all rehab treatment programs, we strive to help patients to achieve abstinence, foster behavioral changes that support abstinence and a new lifestyle, and facilitate active participation in community-based support systems like 12-step recovery. We also strive to help patients identify and address psychosocial problems such as housing, employment or probation, assist clients in developing a positive support network, and more. Our therapeutic modalities. At Crestview Recovery, our therapists are well versed in many different therapeutic modalities. We combine evidence-based and experimental therapies to ensure patients get the most out of their intensive outpatient treatment. Our addiction treatment programs in Portland include the following therapies: cognitive behavioral therapy. This form of talk therapy is conducted one-on-one with your therapist. Recognizing a patient's preconceptions, biases, and assumptions can affect their actions. This therapy examines how an individual's negative thinking can be turned into positive thinking. Dual diagnosis treatment. When patients have an underlying mental health issue, which is common, such as depression or anxiety disorder, this can be the cause of their addiction or at least a trigger. Therefore, to avoid relapse once patients leave treatment, it is necessary to treat both the addiction and the underlying mental health disorder simultaneously. This condition is called a co-occurring disorder. Mindfulness meditation therapy. Mindfulness is the awareness of experiences, feelings, and thoughts as they occur. Meditation is the practice of calming the mind to enhance concentration. By combining the two, this therapy helps teach patients how to live in the moment instead of in the past or obsessing over the future. Doing so fosters the habit of avoiding harmful thought patterns. At Crestview Recovery, our intensive outpatient program for substance use disorder is but one option we offer to promote behavioral change. Call us today at 866-262-0531 to explore our other options and discover how we can support you. Thank you for watching. And if you found this video helpful, be sure to like, comment, and subscribe.